people. Not only wealthy people, not only corporations. A government that doesn't think a corporation is a citizen. Because the first thing you need to actualize a human right is a government that cares about people. But the second thing we need, and probably will be more successful in this, is an organized and educated populace that's willing to fight together. Can we organize a populace that's willing to fight together?
Yes!
We have to. We have to. Because that's the only way to make real political change. And so I think when you look at human rights, we at Partners in Health look at a two-pronged approach. One, you have to have a government that is willing and pushed and enabled to secure the right to health, to secure the right to education. But the second thing you need is a population that's willing to fight for it. We need to fight for it. And so I'm glad to be here, but let's make this bigger and bigger. And all of you young people that are here today, all of your students, thank you. Because you're pushing us. I could just really thank you. We can't do it without you. It is easy for me and anyone, let's say over 50 and a half, to sit in my office and to think I'm doing a good thing. But it's not good enough. It's not a good enough thing. And so we have to be fighting. And it's uncomfortable. You know, protest is uncomfortable. It feels awkward when you're one of 50 people standing with a sign. It's awkward, right? It feels weird. Woo! You want to be part of a mosh pit. You know, you want to be at like the U2 concert. That's what we want. We want that kind of enthusiasm around healthcare, human dignity, and social justice. I know I'm supposed to talk about Ebola. Right? So, you know, I'm the Chief Medical Officer of Partners in Health, where I've been for 15 years. And we like to define ourselves as a social justice organization. We like to define ourselves as part of a movement for health and social justice. We look at social justice and rights through the lens of healthcare. But when you look at social justice through the lens of healthcare, what you see is this. Most illness has massive underlying structural violence, lack of education, lack of food security, lack of a paying job, lack of proper housing. You know, and so if you look at health and social justice and health through that lens, what you see, you open up onto a playing field of lack of human rights and lack of basic dignity. So Partners in Health works very hard to build health systems, but at the same time to pay attention to what we call the social determinants of health, or social and economic rights. The kinds of rights that have been totally neglected by this country. We believe in civil rights, and we don't do a great job in civil rights, as we see from Ferguson and elsewhere. We don't do a great job on civil rights, but we certainly believe people have a right to vote, maybe. People have a right to a fair trial, maybe. But what we don't believe is people have a right to health. It's not in our Constitution. There are countries in the world where healthcare and the right to healthcare is written into the Constitution. And so when people feel their rights are being violated, they have some recourse. So this work that we're talking about here for mass care, to write this into our state constitution at the very least, is critical to us organizing around a right to healthcare. If we don't have that documentation, it is very hard. The Universal Declaration is just a declaration. It has no legal weight. The way to give it legal right is to write it into the law. We have to work to write, that's our ask. Write these things into the law and then organize like hell.
Woo!
Yeah.
Woo!
In Partners in Health, what we're trying to do is two things at the same time. We're trying to help governments to respond and enable them to provide the right to health. In many of the countries we work in, the governments are incredibly weak and they have no money. So one of the ways we try to help them is support public clinics to actually do what they're supposed to do. Provide vaccinations, treat HIV, treat tuberculosis, and at the same time, work to organize people living in communities. Through community health workers, through home visits, through going and seeing what people's vulnerabilities are and encouraging them to come forward and encouraging them to demand their rights. But I can tell you what, people still are uncomfortable, right? I've worked with many of our physicians, our leaders, who when someone comes and say, hey, I need you to help me get my kid into school, they say, well, you know, you're asking too much. No! They should be demanding that. That's actually a right. And every time we're uncomfortable with those demands, it means we really don't understand that these are basic human rights, and people should not have to beg for a basic human right. Yeah. Woo! We shouldn't have to beg, but we do have to fight. And begging and fighting are very, very different. Begging and fighting are very, very different. So, Partners in Health is in many countries, in Haiti for 30 years, and Rwanda for 10. And some spectrum in between. We hadn't started a new health project since about 2008. And then Ebola hit West Africa. And we had two local grassroots organizations that we had helped found, Last Mile Health in Liberia and Well Body Alliance in Sierra Leone. And those grassroots organizations, those community-based organizations, and the governments of those countries asked us for help. They said, we really can't do this on our own. We don't have enough medical professionals. We don't have enough staff. We don't have enough supplies. And this epidemic is racing through our countries. And it took us only a day to say, okay. Only a day to organize ourselves and say, we're not a disaster relief organization, but we are an organization that believes in the right to health care. We believe in a government being enabled and supported to provide that right, and for communities to deliver and act and organize around that right. And so we said, yes, we'll go. And I wish I felt every day since that day on September 3rd, your enthusiasm. It's really hard. And I'll tell you why it's hard. These are countries where healthcare is not a right. Healthcare is there, and in fact, in many countries like in Liberia and Sierra Leone, they don't even have fees. They don't have co-pays. They don't have insurance. So in theory, healthcare isn't right in those countries, but the governments are so weak and so poor that the package of services they provide for free is next to nothing. In Sierra Leone, prior to Ebola, 1,000 women died per every 100,000 live births. That's 100 times higher than the number of women who die in childbirth in the United States. 100 times. Anyone who can sleep at night thinking that's okay really doesn't understand human solidarity. There is no reason that a poor woman in Sierra Leone should die in childbirth. There's no reason a woman in the United States should die in childbirth. These are completely preventable deaths. But what prevents them is a system. It's doctors, nurses, hospitals, supplies, blood. So here we're faced with these countries that have no functioning health system. They have clinics, the clinics are empty. They have providers, the providers are poorly trained. There might be one nurse in charge of a community of 50,000 people. Imagine what that feels like for that nurse. You can't do it. And so we looked at these countries, and having been to Liberia, I can tell you it is exactly the same thing that we saw in Rwanda, March in 2005, when clinics had been closed after the war. Right? It is exactly the same thing that we see in Haiti, that has been totally oppressed by outside forces, predominantly the United States government, where clinics have been closed for hundreds of years. It's the same thing. There are not enough providers. There's not enough stuff. And then comes Ebola. It's not an exotic disease. It's just an infection. There is nothing special about Ebola. It's a little bit more infectious. You know, it's a little bit more risky for providers, perhaps a lot. It's more lethal. But what we've seen now is, in fact, with proper treatment, the mortality is less than 25%. But in Africa, it's 70%. And that's because of lack of systems. And so where does this come into Article 25? If those countries had the right to health care to begin with, we wouldn't be seeing this massive epidemic. And I'm going to quote the president of Nigeria. Nigeria did an amazing job in tracking those contacts. 18,000 people they tracked, 26,000 home visits. And no one thinks Nigeria has the best health system in the world, right? Nobody. But it was good enough that they actually paid people to track those contacts. They had actually had a health system that was working on polio eradication, that was trying to roll out HIV therapy. And on that system, they could layer on Ebola. But if you have no system, then you've got no game. So Nigeria, the president of Nigeria, everyone's cheering for Nigeria. Everyone's saying, wow, this is amazing. Nigeria beat Ebola. It's over in Nigeria. And he said, it's not over anywhere till it's over everywhere.
Yeah.
And it's uncomfortable for me as an American to continually talk about the right to health care when we don't have the right to health care in the United States. There is not a right to health care anywhere till there's a right to health care everywhere.